Today, our Rompendo Fronteiras Ortodontia channel has the honor to interview Dr. Chang Hwai-Nan in Chinese, a worldwide authority in orthodontics. He is the founder and current CEO of the Beethoven Orthodontic and Implant Group in Taiwan, and inventor of infrazygomatic crest and buccal shelf extraocular mini screws for skeletal implants.
His biomechanics have opened new possibilities for the resolution of complex cases, revolutionizing the orthodontics world. Thank you, Dr. Chang, for donating us your precious knowledge, time, and energy.
Dr. Chang, in 2019, your article published at the Angle Orthodontist describes a success rate of 93.7% for infrazygomatic bone screws. This is amazing. Considering your technique is well detailed in your videos, is there any other factor to be considered that contributes for this success rate?
Well, if I want to list the most important one that I didn't describe in my article, it would be the skill level of the operator. Because it's different from one doctor to the other. And I think the key to improve the successful rate would be practice, especially quality practice, make perfect. And you also need to have the knowledge to understand that when you put a screw, you need to immediately recognize the density and the quality of the bone. If the bone quality is not good, you need to search the other position.
Dr. Chang, when planning an MS retraction with buccal shelf mini screws to correct a class 3 malocclusion, do you think thickness of the mandibular symphysis could represent an impairment for this mechanic?
The answer is yes. The symphysis is a big problem. If you want to retract the incisor in a very large scale, sometimes the low incisor apex will go out of the bony houses, which is symphysis, in the cephalometric. But is that a big problem? Based on my observation, although I haven't done study related to this subject, but based on my observation and my teacher, Dr. Jiang's observation, I think if the PDL is in good shape, the PDL can regenerate the bone later on.
Some class 3 cases present vestibularized lower incisors, while others present them lingualized. As we perform a mass retraction with buccal shelf screws, does the incisors position influence this mechanic?
Oh, sure. I assume that the question is, if you have the retrocline incisor and flaring the incisor, what's the difference? In big class 3, if you have flaring low incisor, it's easier for you to correct the problem because the top used to be too much. But if you have a retrocline low incisor, and you do need to flare the low incisor out first and retract later on. Otherwise, it will be too retrocline.
Currently, some orthodontists are using cortical perforation as a resource to accelerate the dental movements during the orthodontic treatment. Do you think that it would be interesting to use this technique as an adjuvant in an MS retraction with buccal shelf mini screws?
Oh, of course. When we are talking about large scale of tooth movement, we are talking about to use the tooth as a tool to resolve the bone. And if you can use perforation like those methods to perforate the cortical bone, of course that will accelerate the tooth movement. But for me, that is not the routine procedure for me. If I do have surgery like impaction surgery, I will perforate or remove the cortical bone because it's easy for me to do that. But routinely, when I put the buccal shear screw, I don't do bone perforation to accelerate.
In class 3 malocclusion cases, when a mass retraction is impossible because the proximity of the inferior molars and the border of a semiramus, maxillary retraction could be an alternative for treatment. In this case, would you please tell us what technique would be your preferred choice?
If you cannot move the lower dentition backward, that usually is because the retromolar soft tissue is too much or the bone is too much. So you probably can cut the bone and cut the soft tissue. But if you don't want to do that, to increase the room for the posterior, you can use class 3 elastic to correct this malocclusion. And I have seen Dr. Hwai-Nan treat very difficult class 3 with Damon braces and elastic only. But the condition will be pre-treatment, the maxilla is underdeveloped. If the maxilla is in the normal position, you use class 3, you will end up with bimaxillar protrusion. And for the oriental patient, we do have a lot of patients end up with bimaxillar protrusion if you only use the Damon braces and class 3 alone. That's why in oriental population, the mini screw is very important.
In patients that present maxillary atresia and posterior crossbite, in which the dental expansion alone is not enough to achieve the crossbite correction, what's your first choice technique to solve those cases?
In oriental population, we really think very, very narrow maxilla arch, very narrow, very few. Only in some cleft palate patient we have narrow maxilla. The rest, I think my regular self-ligation braces should be sufficient to expand the arch. And talk about if you do have very narrow upper arch, I saw Dr. Hwai-Nan treat adult patient with very, very narrow maxilla. And he can just use his self-ligation bracket to develop the arch. So for me, I haven't used RPE for the past 15 years. I only use the self-ligation bracket.
Dr. Chang, what do you think about the role of transplant aligners in curator orthodontics? What do you think about the association of your skeletal anchorage techniques with extraovular mini screws and transplant aligners?
I believe aligner will get more and more popular in the near future. So I do believe it is the trend. If you haven't studied or haven't used aligner, from the bottom of my heart, I strongly suggest you should expose to aligner therapy. Talking about aligner is a piece of plastic. Of course, it's not as effective, as strong as fixed price. So aligner do need help. For difficult cases, what you can do pre-aligner treatment or mid-course treatment with fixed price, or use the anchorage. And I think that outside the root, which is extra-alveolar screw that I use today, is the perfect combination with aligner. Think about it. Aligner is moving the teeth, moving the dentition, and your screw is outside the dentition. It won't bother the aligner. So I get so excited when I combine my screw with this aligner. And I do encourage you to think about it and learn this issue.
Dr. Chris Chang, for who desire to learn your techniques directly from you, where our colleagues can find information of how to do that?
Well, the best way will be visit my office. We have a 3-day international course plus 2-day keynote presentation course. So that 5-day can help you to understand and actually practice the technique that I use in my clinic.
Dr. Chang, do you have any course or speech program here in Brazil this year?
The coming up April 2nd in Curitiba, we have a one-day course there. I really welcome you to join us in this great event. I think you will be happy that you involved this event. Thank you, my friend. Thank you.
So guys, we see you in Curitiba in the Ortho Science event.
Thank you, Dr. Chang, for this interview, and we hope to see you soon here in Brazil. See you guys.